Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Today, we are going to be talking about constipation in pregnancy. And to throw some nutritional light on this very hard subject, our guest of honor today is Mrs Juhi Mimani. Patients come to Juhi for two reasons. Most of them, of course, come to her because they have heard from countless other people that she's fantastic with her work. The very small few people who don't know her. I repeat, the very, very small few unfortunate people who don't know her come when they get to see her picture. So she's beauty with brains personified, a celebrity nutritionist. She's the founder of JM Nutrition, after having completed her graduation from UK and then moving on to acquire a diploma in nutrition and health education and a diploma in dietetics, health and nutrition. I hope I've pronounced that correct. Thank you, Juhi, for coming on to the show.
Thank you, Doctor, for an overwhelming introduction. The pleasure is all mine.
Thank you again, Juhi. And before we chew Juhi's brains about how diet can help with this problem, let's try and understand the problem a little better. So, constipation is the most common digestive problem in the world. Pregnancy is probably the most common event to happen in a woman's life. Now, when these two come together, it is a perfect recipe for disaster. Constipation affects about 38% of women in the first and second trimester, 21% in the third trimester, and 17% post-delivery. It may happen for the first time in pregnancy, or it may be an aggravation of a previously existing problem. Thus, women who are already suffering from nausea, vomiting, bloating, weakness, headache, indigestion, aversion to food, that's a lot, dizziness, breast tenderness, and anxiety, to name a few of the problems, are further burdened by constipation. It seems then like a final nail in the coffin. Let's understand 10 reasons why constipation happens in pregnancy. Number 1. In the first 9 weeks of pregnancy, before the placenta forms and takes over, progesterone is secreted by the mother's body to support, nourish, and maintain the pregnancy. The rising progesterone levels and sometimes the progesterone supplements that we give in pregnancy, unfortunately, reduce the intestinal smooth muscle motility. To put it simply, they make the bowel movement slow. Point number 2. This progesterone also reduces the secretion of motilin, a peptide hormone that promotes bowel motility. So again, because of the reduced secretion, the motility of the bowels is lesser. Number 3, relaxin, a hormone that prevents uterine contractions, which is a good thing, also lands up relaxing the bowel muscles. Thus, we see that a lot of good is happening in the body to protect the pregnancy, but sometimes it lands up also causing some trouble like constipation. Point number 4, there is increased water absorption from the bowels and the kidneys, thus leading to reduced water content and hardening of stools. Point number 5, nausea and vomiting leads to reduced fiber and water intake, which adds to the problem. Point number 6, if maternal activity is reduced, it again increases constipation. Moreover, pregnant patients are generally inactive, especially in the first 3 months of pregnancy, and this aggravates if they are put on bed rest by their doctor or by their family members. Point number 7, iron supplements that we give in pregnancy are notorious for causing constipation. Point number 8, thyroid disorders or irritable bowel syndrome can sometimes complicate matters in pregnancy by further causing constipation. Point number 9, in the third trimester, the enlarging uterus may compress the bowels and slow onward movement of the bowels may be hampered. And last but not the least, point number 10, in the postpartum or after delivery stage, hemorrhoids or piles, anal fissure or pain at the episiotomy wound may be the reason for constipation. So besides the obvious discomfort which constipation causes, there are 5 other problems associated with it in pregnancy. 1. Constipation leads to gas, which again leads to more nausea and more aversion to food, and it becomes a vicious cycle. 2. Stomach pain. 3. Anal fissures because the anal passage may tear because of hard stools. Point number 4. This excessive straining can lead to some nerve damage and weakening of the pelvic muscles. And lastly, excessive straining may also sometimes lead to bleeding into the pregnancy. Lastly, what are the 10 things that you can do to relieve this constipation? 1. Start exercising, but of course, with the consent of your doctor. 2. Drink plenty of water. 3. Include a lot of fiber, figs and prunes in your diet. Of course, this will be dealt with in more details by Juhi Mimani, our guest of honor, in a couple of minutes. Point number 4. Take small frequent meals in your diet. This helps the stomach digest them more easily. Point number 5. Probiotics can normalize your gut flora and sometimes relieve your constipation. 6. If you are on progesterone medication, ask your doctor if it can be reduced or stopped. 7. Speak to your doctor and stop iron medications, or change the brand, or get iron injections administered if you are iron deficient. Point number 8. Limit the amount of caffeine you take. Point number 9. There are some very safe medications which can be used. In pregnancy, we obviously want to use as little medicines as possible. But if we have to, it would be a blessing if the medicines did their job without even being absorbed into the system, thus ensuring that they won't affect the baby at all. So bulk-forming agents like isabgol husk, osmotic laxatives like lactulose and macrogols do just that. Oral medicines that one normally uses for constipation in the non-pregnant state should not be used in pregnancy, as it can be harmful to both the mother as well as the baby. Remember, your doctor knows best. Speak to him or her for advice at this step. Lastly, speak to your nutritionist. Technically, this should come before you take medicines from your doctor for constipation. Diet has a huge role to play in relieving constipation, and we are going to do just that today. So, as I said earlier, we have the lovely Mrs Juhi Mimani with us, and she will tell us how we can use diet to our advantage. Juhi, over to you.
Thank you, Dr. Rajeev, for the fabulous introduction. It makes it even more special when it comes from someone as brilliant and eminent as you. Dr. Rajeev has already given an insight as to the ill effects of constipation during pregnancy. However, constipation is an issue that can be very easily treated by a well-planned diet. First, let's talk about some of the primary foods that are in most cases the cause of constipation. The very first and probably the biggest culprit of constipation and various other problems during pregnancy is processed and packaged foods. While all of us like to have packaged foods because of taste and convenience, what we need to realize is the high contents of sugar, salt, sodium, preservatives, etc. in these foods, which completely rid us of any or all nutrients that our body consumes. This leads to major indigestion and gastric distress, increase in blood pressure, and a compromise on overall health. Few examples of these are chips, breakfast cereals like cornflakes, biscuits, processed breads, aerated beverages, jams, sugary products, and the list goes on. Another type of food to avoid is any refined food produced like refined flour or maida, sugar, basmati rice, etc. These refined food products, despite being used in everyday cooking at home, have been stripped of their fibers and most other nutrients in the processing stage. As a matter of fact, even something as simple as fresh squeezed fruit juices have lost all the fiber content and as such contribute to poor digestion and constipation. Let us now discuss the foods which are very rich in fiber and will help us in treating or limiting constipation. Number 1. Dried fruits like dates, prunes, figs. Incidentally, dates and prunes can be made into a paste and can be a great substitute for sugar in your everyday diet. These dried fruits are naturally rich in fiber and iron as well. While iron supplements can cause constipation, the fiber content here helps to ease the ill effects of the same while providing the body with natural iron. Number 2. Seeds like chia seeds and fenugreek are a natural laxative and help in regulating the bowel movements. We can easily put fenugreek in parathas, rotis, curd or even salads. A great way to add chia seeds in your meals is by adding them to porridge, oatmeal, coconut water or buttermilk. A yummy and fancy way to consume this is to make a breakfast bowl with cold oatmeal, fresh fruits, chia seeds and honey. Just remember not to add this to anything hot. Number 3. Whole eggs. Contrary to a popular belief, a whole egg omelette is much better than an egg white omelette to ease constipation. This is basically because of the good fats like omega-3 and omega-6, which is only there in the yolk of the egg and is much needed during pregnancy. A tip to make the perfect breakfast to help you here would be whole eggs omelette made with lots of green vegetables for a delicious and wholesome meal. Number 4. Fruits and vegetables can add extra roughage to the diet. Some of the recommended fruits and vegetables would be pears, chiku, mangoes, bananas, spinach, broccoli, onions, lettuce, beetroot, etc. Remember, roughage is your ally in this fight against constipation. Number 5. Pulses and lentils like green moong dal, rajma, chola. These can be made into a khichdi, which in itself is a superfood. And this can be made out of different kinds of dal like whole moong dal or moong dal, arhar dal, etc. Number 6. Let us not forget the age-old traditional foods like ghee and Indian spices like turmeric. Other recommended foods to add to your diet would be unstrained soups, dalia and barley. They are rich in multiple nutrients and are great for you.
You know, Juhi, before you move forward, I couldn't help but make a comment in the middle. This chia seeds are those gooey things, right? I mean, which when you put into your mouth, they kind of swell up and it's very difficult to consume. I've been advised them myself, and it is absolutely impossible. If you put them in water, the damn things swell up like there's no tomorrow. And if you put them in your mouth and try and have water over it, it's very difficult. So I guess you were saying something about putting it into various cereals, etc., and making it a little more palatable, I guess, right?
Yeah.
So that probably might just help. Otherwise, consuming it just like that is a little difficult. But I believe it's a superfood. Am I correct?
It is, because it has very high amount of fiber and protein and omegas.
Wow. Why do all the horrible things have to be good? Okay, please carry on. Sorry,
doctor, no problem, doctor. Actually, when you put it in coconut water or buttermilk, let it swell in that water for 5 minutes, and you can just gulp it down. It wouldn't even taste anything gooey in your mouth then. Just gulp it with your water or something.
I shall try that the next time for sure.
Yes.
Yeah, you were saying.
A lot of people either have pre-existing allergic conditions or develop allergies to foods during pregnancy, which can also be a cause of indigestion and constipation. The most common allergies or intolerances are towards gluten and lactose. For those of you who have a gluten allergy, the best substitute grains are ragi, buckwheat, jowar and bajra. These are often considered more nutritious as they are high in iron and fiber both. People with lactose intolerance should also switch to soya milk or oat milk, which are lactose free and full of proteins. Sometimes, even though we know what foods can help us to avoid certain issues, we are often confused as to how we can inculcate the same in our daily meals. So here is a basic step-by-step approach to help us to avoid constipation. Firstly, start your day with 10 raisins or 2 dates. This needs to be the first thing that you eat in the morning. Secondly, add 2 teaspoons of chia seeds in either a glass of buttermilk or coconut water. Thirdly, add 3 fruits in your daily diet, and the most recommended ones are pears, banana, oranges or mangoes. Follow these recommendations for about 3 to 4 days and check if this eases your constipation. In case these recommendations don't help at all, then we need to add on 2 more steps, which are drink a cup of warm milk with turmeric before sleeping. For people who are lactose intolerant, they can also have a cup of soya milk instead. And have a small portion of salad with all your main meals, which is your lunch, dinner and breakfast. These 5 steps will definitely ease out constipation issues in most cases. In case even after following these 5 steps for a few days does nothing to cure constipation, then you should speak to your doctor and get medication for the same. I would also like to reiterate a couple of points that Dr. Rajeev has already made, which are regular exercise and proper water intake. Both of these are of utmost importance. Overall, during the pregnancy period in particular, we should always focus on having whole foods as they contain all natural nutrients which are unadulterated and perfectly synced to the needs of our body.
Fantastic. Thank you so much, Juhi. Because we read a lot of, as I said, even when I read on the net, I knew about figs and oats and chia seeds and everything else. But the practical problem of how do I incorporate that into my diet? What do I take first? How do I make a stepwise approach wherein my constipation is going to get better? So I think this 5-step approach of yours is going to be absolutely brilliant. Thank you so much.
Thank you so much, doctor, for helping me out.
I sometimes, feel that people underestimate the value and power of diet and diet management. I advise every single pregnant patient of mine to undergo a diet consult, irrespective of whether they have a problem or not. Many of them have the same standard answer. Oh, but then my doctor, my diet is always very light and healthy, and I don't think I need a diet consult. So, this is a very, very standard reply that I get from almost everyone, which is fine and also fair. But when that also applies to people who have constipation, weight gain, or gestational diabetes, then as their doctor, I'm seriously concerned. Because they also come back with the same reply that, I hardly eat anything. So how will a diet, kind of help me? So there is still a lot of myths, perceptions, and a lot of lack of knowledge regarding the importance of diet in our society. So thank you, Juhi, for making it so simple and yet so useful. I'm sure our pregnant patients suffering from constipation will find great relief from your advice. Thank you once again for coming to the show. So friends, this brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Apple and Google as well as on Spotify. Do subscribe and leave your comments and suggestions on the Apple Podcast app. That's the only way we can make this better. Looking forward to great interactions. Keep listening.